everyone, I'm Emmanuel Sebakungu. I'm a student at Southern Hampshire University through KEPRA program. In this video, I'm going to tell you about evolution and importance of social media in healthcare. Starting with the meaning of social media. Social media is referred to as websites and applications that are designed to allow people to share information or content quickly, efficiently, and in real time. So, then the social media in healthcare made great changes. Many people now know and use social media every day. But a decade ago, many people were not aware of social media and not accessing the internet at that time. In that time, smartphones were not introduced so that people should use them. Contrary, in nowadays, where most people can't live without accessing different social media such as Facebook, Twitter, Instagram, YouTube, and other social medias. Then, according to Ventola 2014, the use of social media is widespread across all ages and professional and is pervasive around the world in healthcare. For example, in 2005, in the United States, the proportion of adults using social media has increased from 80% to 72%. These percentages shows that there was a great increasement in using social media in healthcare. And in 2012, Facebook users exceeded 1 billion people on the world using it in healthcare. This number is very high because it was 1/7 of the world population. Moreover, each day 100 billion active Twitter sends more than 65 million tweets and 2 billion videos are reviewed on YouTube. As time goes on, the physician use social media a lot. For instance, the physician who used social media in 2010 were 41% and 90% in 2011. In 2017, in the United States, healthcare providers indicated that they spent approximately 1 hour on social media every day. 40% of healthcare consumers utilize the social media for their healthcare information needs. And additionally, young generation from 18 to 24 years of age group used and believed healthcare information presented in social media. Hospitals and healthcare workers engage with one another via social media to decide on their healthcare providers. According to the resource called Social Media Usage Among Healthcare Providers 2017, social media has proved to be a communication system for healthcare workers through which they can find patient health information and the past medical history so that they can review relevant information about illness. And nowadays, we live in a world where Facebook alone has 1.65 billion active monthly users. With this, healthcare providers, professionals are using social media than before, and many people use it looking for health information that can help them to be informed or get the doctor they need. Healthcare providers are communicating effectively on social media where people are getting shared information and the audience commented on the health information shared. According to Allied Health World, 24% of doctors use social media at least once a day to post or seek medical information that can help them take care for their patients. With this, you can see that this percentage can help. Means that the doctor use a lot of time so that they can get some new skills that can help to care about their patients. Then apart from that, with this social media has a lot of importance in healthcare for both patients and health provider. Then this social media helps a lot. It helps a lot patients and healthcare provider in different ways. According to social media and healthcare professional benefits, risk, and best practices, social media is improving clinical educations, where healthcare they teach different students via social media and enhance the understanding of communication, professionalism, and ethics through social media sessions. Social media also are being widely implemented in undergraduate pharmacy curriculum. 1/3 of pharmacy programs have reported using Twitter in some capacities. And in 2011 survey also found that 38% of pharmacy faculty members use Facebook for teaching, with that half reporting that they plan to use social media in the future. For instance, an instructor in a geriatric pharmacotherapy course at the University of Rhode Island used Facebook to encourage class discussion and to connect students with the senior citizens who had volunteered to participate in the course. This experience improved student perceptions of older and adults, and also introduced senior citizens to Facebook so that they can use it in healthcare. Then studies have shown that this use of social media can greatly enhance the image and visibility of medical centers of hospitals. Hospitals' social media presence would strongly influence their choice regarding where to go for services. A strong social media presence was also interpreted by 81% of consumers as being an indication that a hospital offers cutting-edge technologies. Another study shows that 25% of surveyed healthcare organizations reported that having successfully attracted new patients through the use of social media. According to the resource called the 5 benefits of social media, crisis situation. Social media provide information to consumers where there is a crisis reason. For instance, in Japan, in 2011, doctors used active Twitter to update the ill patient. And then in 2009, in the US, Center for Disease Control and Prevention used social media networks to educate people about H1N1 virus. Social media network offers for users to clarify doubts and debts and questions that are responded to them by peers or professionals. For example, hashtag campaign on Twitter and Facebook for organs donation and fundraising have helped people to go through treatment that wouldn't have been possible without social media networks. According to the resource called How Social Media Can Influence Patients and the Healthcare Community, patient can support other patients. Yes. Then patients with mental or physical health condition can also find support group or other with the same condition. These support groups have been found to help those with serious mental illness by providing support and hope from others who have improved. Apart from this, peers can also provide feedback about treatment that worked for them or side effects that they experienced. Social media can be used fairly easily for marketing healthcare services. Of course, Companies can advertise services offered and the award received. However, healthcare professionals can also market their services in other ways just by communicating with patients and communicating information. Another point about the importance of healthcare information, social media gives a good opportunity for healthcare organizations to raise awareness about sought after health problems such as diabetes and cardiac diseases. Then the patients who are looking for information, for healthcare information, can search on social media the doctors, hospital, as well as specialists whom they can network with. That information can help the patient to pick up the right doctor and the location they need. Social media can serve an effective way to communicate for doctors to expand their knowledge and the professional network beyond geographic border. With these, doctors can share their researches and experience and work collaboratively by accessing medical journey through social media. With this said, they share their experiences and their barrier they meet so that they can learn together how to fight against those barriers. Then, apart from the importance of social media, I would like to suggest some policies the company should follow for effective social media in healthcare. Then, the healthcare provider, they should not have discussed confidentiality of the patient on social media. Patient confidentiality must be protected at all times as HIPAA rules protecting identifiable healthful information. We know that HIPAA implements security measures to ensure sensitive health information remains private and confidential. If the health institution reveals the privacy of the patient, it faces to face financial penalty, and the financial depends on the severity of the violations. A healthcare provider needs training so that they can know more how to use social media professionally. And this training will help healthcare provider to know what to do before posting or sharing any information so that it can't damage the reputation of the health institution of the owner of healthcare provider. Another thing is that healthcare provider are not allowed to post pictures and share information of the patient without documented consent if necessary. This means that any healthcare staff who want to post or share information must receive permission to ensure that there is no information appeared prior posting. This way will protect the patient organization in a good way. Lastly, healthcare provider must respect the policy of healthcare institution so that they can protect themselves and the confidentiality of the patient, so that they can't face HIPAA rules and regulations. Thank you. If you have any problem, you have to jot down any comment.